Our next speaker is Lakshmi from the National Cancer Institute. She's going to be talking about how to use Facebook effectively, which I'm really interested to hear about, because to date my strategy has been to not use it at all. So I want to learn something here. Lakshmi Grama.
Thank you. Managing Facebook effectively, particularly for a government agency, is always a challenge. And so I thought, just to give you a little bit of a background on who we are, just in case you don't know, it's hard to escape us in the Bethesda area. The National Cancer Institute is part of the National Institutes of Health, and it's one of the largest of the ICs within NIH, and is the lead federal agency for cancer research. And a lot of our work is primarily in supporting grants and research across the country and internationally. So somebody might ask, what's a research organization doing on Facebook, and why do we need to be in social media? And we asked ourselves that question about 3 years ago. I can't believe it's been 3 years since we've been on Facebook. But we asked ourselves the question about, do we want to be on Facebook? What do we want to do? How do we do it? What are the kinds of things we might run into? And are we really prepared to deal with being in a very public forum like Facebook? So this is our Facebook page. If you really want to go and check us out, we're on facebook.com/cancer.gov. And as you can see, we have 19,000 likes, and we're growing. And we also have a Spanish counterpart, which we launched the last year, and that's also growing by leaps and bounds. So when we started with Facebook, some of our goals for engagement, for being on Facebook, was really reaching out to those people who really want to know what's happening in cancer research. And it's interesting, a lot of people are interested, whether they've been touched by cancer or not, they are interested in knowing what's going on. There are people, of course, to support patients, our family members, caregivers, people who have a loved one that they're concerned about. And more you're seeing that people are looking at social media for health information. In fact, it's interesting, as the statistics keep rolling in, every time you see how much people are turning to social networks as their primary source of health information. And of course, we are a publicly funded agency. We need to make sure that we are, people know where we're spending our money and how we're spending it. So part of our goal was also to enhance transparency, enhance public trust in the science we support. More people know about what we do and how we do it, the better chance there is of greater support for research in federally funded research. So even though that may not be at the top of mind for most people, I think it's a very important thing for government agencies to really look at. So when we have these major goals and we were looking at how do we do this, what would be our challenges? So, all of us who are in the government are fairly risk averse. It's hard for us to get into some of these new platforms without thinking through the what ifs and how do we deal with it. So, of course, one of the first questions that came up is, what about the personal questions we're going to get? People are going to be telling us all about their specific type of cancer, what they're going through, how do we deal with that, what about the privacy issues? We also know that wherever we've been in public forums, there are people who are willing to hijack the conversation. There are people who have agendas, and very legitimate agendas, not that we question their motives or their desires and their passion for their causes. But it's very possible that that kind of passion could derail a public foray into something like a social network. Another big danger, particularly from our scientists and people who really look at evidence-based resources, is what about all those people who are selling cures? And for cancer, there are a dime a dozen, and there are some very organized and some who are not so organized. So how do we handle them? Of course, you know, social media is 24/7. How do you respond? How are you timely? How can you make sure that if there is a question that seems very important and urgent from the perspective of a family member of someone who might have a cancer diagnosis, how can we make sure we have timeliness of response? And of course, when you put all of this together, the biggest question is, how do we get the resources to do this? We really couldn't go, we couldn't go and ask for more resources. Most of the time we're being told do more with less. And so this was again one of those scenarios in terms of how do we do more with less. We know we need to be on social media. So at that time, I think we were, you know, thinking about all of the resources we had, and we said, what resource do we have that's constantly doing this, that has this conversation with the community outside? And it was our contact center. We've had a contact center since 1975. We've gone through many different changes in technology since 1975. The contact center started with the phone, then we were on fax, and then we moved into email and live help. So we had evolved with technology, and this service was able to cope with these changes. And so it seemed like, why not tap into the contact center for looking at helping us do this? The advantages, they had standard responses to various questions. They knew how to handle very sensitive issues. They were experienced in going through, in responding to, particularly to patients and family members. So here's some examples of the kinds of things our contact center has been doing. So cancer questions. There's people who might have a question about, you know, have a neighbor that came in and about somehow they could help. And again, this is a very standard response that somebody sends in via email. We might respond the same way. We had another way is actually dispelling some misconceptions that there might be. So here is someone who talks about antioxidants in the same breath as herbal life. And we, as purveyors of evidence-based information, want to make sure that we can get to them and explain that not all herbal supplements are created equal, that they need to look carefully at the evidence before they actually take some of these. Then we have questions related to where's the money going? So it's your money and you need answers. So someone asks us, and you know, about funding. And where are you spending the money? And how come childhood cancer doesn't get as much money as it should? And this became a very detailed conversation with this person talking about our funding, how we do our funding. This again would not have been possible. This is transparency. This is letting people know how decisions get made. You may not agree with our decision, but that's okay. We need to tell you how these decisions are made. And so this was a conversation related to how funding decisions are made with, particularly for childhood cancer. All of this takes effort, and this is where we found that leveraging our contact center, the Cancer Information Service, really helped. And our community managers have a lot of experience dealing with this, and I'm glad that our Spanish Facebook community manager, Megan's also here. And so if anyone later on has questions that are more specific, she's a great person to talk to. Thank you.